I'm Patrick McGarry, the team leader for Health of the Public programs at the American Academy of Family Physicians. We have two programs specifically addressing tobacco control. One is Tar Wars, that volunteer family physicians will go out into the classroom and present to 4th and 5th graders and teach them about the dangers of smoking. They're very effective because many young children respect doctors in their opinion and therefore are more likely to delay initiation or not begin at all. I'm looking forward to getting the latest research and information on tobacco prevention and control. I've always been interested in the advocacy aspects of it, and this conference certainly offers that opportunity. I'm reminded of an experience I had at the 2009 conference in Phoenix, where I was surprised to learn about cigarette smuggling and the amount of burden that places on the taxpayers and state and local governments. It's estimated that $5 billion a year is lost in tax revenue by people smuggling cigarettes. And Arizona provided a great opportunity to demonstrate that from people from California and Colorado and New Mexico buying cigarettes in their state and then selling them in Arizona at a cheaper price. And you can make a lot of money that way. So that's pretty shocking, and I enjoyed that kind of stuff. Well, I am actually an ex-smoker. I smoked for too long. I fortunately quit 20 years ago, but I will say it was not easy. It took me 5 attempts, but the research says it takes 5 to 7 times. I was very successful the 5th time. Not so the other times. I quit one time for 2 years and was playing a game of cards with my friends, and somebody lit a cigarette, and I just immediately wanted a cigarette, and that's why I started smoking again, which is insane because I had quit for 2 years. I became active in tobacco control about 30 years ago when I was in graduate school, and I was able to write a program called Up and Smoke, and it's similar to those things that talk about how much smoking costs over a lifetime. And when I added in costs for dry cleaning, for ruined upholstery, for painting, all those costs, and most importantly, the healthcare costs associated with smoking, it really opens people's eyes. And we're talking about the tens of thousands of dollars at least. So I actually got an AMI project and also an assistantship in the computer lab. So that paid off too. I've been involved in tobacco control from a state perspective. Since 1993, I wrote the first impact grant for the state of Illinois. We were successful in receiving funding on that. Then I enjoyed my relationship with the Centers for Disease Control Office on Smoking and Health. I have a long relationship with them. I served as the state of Illinois tobacco program manager, where we were very successful in having creating a smoke-free Illinois with the assistance of our colleagues at the Lung Association of the Upper Midwest, along with Heart Association and other groups that are dedicated to the cause.